Hello, Dr. Mary Elder with 4 Points Family Chiropractic here. Thanks for tuning in for our brief Facebook Live here about eating for health. I wanted to do this because I feel like this gets overcomplicated pretty easily. There's a lot of different opinions about how to eat, paleo, vegan, there's all these different ways for you to be designing the things that you eat. Well, I just want to cover some real basics here. Something else I want to be sensitive to, it's really easy to get like way too focused on what you're consuming and kind of ease yourself into almost a disordered approach to eating. And I want to make sure everybody does their best to avoid that. Remember, it's just food. You get to make a decision the next meal you have. So don't put too much pressure on yourself. If you hear any meowing here, we are joined by a cat. He refuses to move. He wants to be a part of this. He's on my notes. We're going to do our best. Okay. So, he's like really on the notes. There we go. So what I'd like to talk to you about are some general guidelines, some things that consider when you are trying to decide what to eat, how to prep, what decisions to make as far as diet for you and your family go. One of the things to address is what a macronutrient is. So there's 3 macronutrients. Micronutrients are a whole other talk. I could do a whole other discussion on that. But the 3 macronutrients that are talked about the most are carbohydrates, fats, proteins. Now, in the past 30, 40 years, all 3 of those have been demonized in some way, shape, or form, and easy to talk about how they're wrong if you're doing too much of any of them, right? It's all about balance and figuring out what percentage of each of those things to have in your diet. Now, what I'll say here is there's all these great apps that will track this for you, and they'll let you know what percentage of things you're consuming. Each person is individual, so it's awesome that low carb works for some people and high fat works for some people. Figure out what it is that works for you, and the things to pay attention to is how you sleep, how you digest, your energy, and just how you kind of generally overall feel. And that's what's to pay attention to kind of decide what ratio really works best for you. And again, it's not a hard and fast rule. You just kind of pick generally what's going to be best for you. I will encourage you when you're deciding your metrics and how much of each thing to consume, please get at least 30 grams of protein every meal that you eat. Shoot for more if you would like, but at least 30 grams. If you want to know why, go back and listen to my talk on longevity. It has to do with making sure you have enough lean tissue to age appropriately. So protein, always make sure that you get plenty of protein, plenty of hydration, those 2 things. All right. The reason we even want to talk about what our eating habits are, when you look at how health is discussed in the United States, it's a lot of sickness care. We're very reactive, and we've found ways with medication to mitigate a lot of this, to manage it. Things like statins, blood pressure medication, but rarely will you find somebody talking to you about how to prevent these things or how to catch them early and reverse them. And that is possible. That's something that you can do. Most disease in the United States is secondary to metabolic dysfunction, meaning your cells are taking the energy and they're not using it appropriately. They're getting sick and they're causing bigger issues, things like blood pressure issues, diabetes, prediabetes, insulin resistance, cancer. All of those things are metabolic dysfunction. So there's 5 labs you can use to monitor your own metabolic function, and they're pretty standard. They're being run by most doctors, and if you're in the normal range, good, but look at what optimal range is. So the way to know whether or not you are in metabolic dysfunction is, okay, no medication. Say you get your blood work done and you're on no medication. You need to be able to have 5 numbers that you're hitting, which is a fasting glucose below 100. Your triglycerides need to be less than 150. Your HDL for men should be less than 40, for women should be, or more than 40 for men, HDL, more than 50 for women, HDL. Your waist circumference for men should be less than 35 inches, for women less than 40 inches, and your blood pressure should be below 130/85. All of that unmedicated. So you might be hitting those numbers but have been on blood pressure medication, for example. If you can hit all 5 of those numbers with no meds, then you are metabolically healthy. Less than 7% of the United States population hits those 5 numbers with no medication. Let that sink in for a second. Less than 7% of the United States can hit those levels with no meds, with no intervention. And so much of it is because of what we're consuming. The biggest problem being the ultra processed foods that are just readily available to us. They're available, they're easy to get, they're pervasive, and they're sneaky. You know, a lot of these things, you might think that you're having a really healthy salad, but it might have an ultra processed protein source or dressing or something like that in it. And it's just good to be aware of that, because then you can kind of make decisions when you're out and about what you're consuming and what to be paying attention to. But these diseases, Alzheimer's, diabetes, you know, they're not drug deficiencies. They're lifestyle things that we're doing to ourselves and then having to use medication to combat them, which again, might not be necessary. So many of these lifestyle things can be handled independently. The NIH study I was reading when I was researching for this was talking about how ultra processed diets, people who ate those were eating an average of 500 more calories a day and having no idea that they were doing so. So that is a huge increase in caloric intake. I mean, for a full-grown man at 2,000 calories a day, that's a full quarter of that more than you were expecting to be consuming, all because the quality of the food was coming from something ultra-processed. Now, the reason that happens is the ultra-processed food and the way it breaks down in our body, it digests slower. So the unprocessed food digests slower. Sorry, processed is faster, spikes your blood sugar, and just sets everything in motion. You want to be focusing more on getting unprocessed foods as much as you possibly can. So, you know, fruits, vegetables, whole grains, legumes, beans, nuts, seeds, good quality protein, all of those things are unprocessed, so they digest slower. When you're digesting slower, your glucose levels stay even. They don't spike and then drop like that. And that process in the bloodstream will prevent you from doing things like having blood sugar crashes, getting tired in the afternoon. You want to keep your blood sugar as steady as possible, and unprocessed food does that for you. Now, I'm not saying eat raw all the time. Raw is the ultimate unprocessed, but you know, steamed, baked, different ways to cook it without a bunch of seed oils or processing other chemicals into it. Those are going to be the best things to be focusing on as far as what to be consuming. And, you know, over time, what that does is it also decreases your cravings. That's something that we'll hear a lot from patients, is that they're getting frustrated because they can do good for the daytime, but then, you know, after dinner at 8 p.m., they want ice cream. That's a craving from a blood sugar crash earlier in the day. It's also a craving, by the way, from your fauna. So the microbes in your body, those start to get used to certain foods and they send demands to your brain requesting those foods, and your brain just kind of gives it to them. So that breaking of the habit is a challenge, but it's definitely worth it. Because of what it'll do for your blood sugar and your health long term. So if this is something that you have been focusing on and you'd like to talk more to your doctor about, or you know somebody that needs to be assessed for any sort of sluggishness in the neurology of their digestive system, they can reach out to our office. If they use the word phytonutrients and reference this Facebook Live, they can get the full exam, including any necessary x-rays, orthopedic tests, neurological testing, and a review with the doctor. That's normally $348. They can get it for $97 if they mention phytonutrients, and we'll include a pillow to help support the curve in the neck as well. Now, the reason the nervous system even plays into any of this, your body is intuitively intelligent, right? So when you're eating high processed foods, the digestion's not working well. That feedback's going to your brain and it's slowing everything down, which again is why that crash happens afterwards. Our bodies, when they eat whole food, they know how to self-regulate. And what I mean by that is appetite, digestion, energy allocation, where it goes to in your body, you know, your brain, your muscles, your lungs, your stomach, all of that. It regulates much, much better when you're having less processed foods. Again, that depends strongly on your neurology functioning appropriately. So those are patients that we do tend to talk to about their stress levels, how well they're mitigating, lifestyle, all of those things, because that's what we're trying to coach people on so that their food and what they do intake is going to be appropriately managed. When you are trying to set up a new way to kind of think about your food and how you're eating, one of the things I hear a lot is that there is not enough time. You just don't have time to do things. I totally get that. A lot of us, work long hours and then come home, and the last thing we want to do is open the fridge and prep some food. I would make some suggestions here, and these are just things that I have found that work for me. So I pick about maybe 2 days a week where I spend 2 to 3 hours just doing a whole bunch of food prep. And the way I do it is, my favorite tool in the entire kitchen is my crock pot, a slow cooker. You can throw any protein you want in there and pretty much it'll take care of itself. It's enough that you can kind of shred it up, cut it up, and put it into other things. So you can use it for salads, stir fries. I'm really into stir fries right now. My newest little gadget, and I think I posted about this on our Instagram, is a little vegetable chopper. So you put your veggie in there and you just shove it through and chop it. You can also grate things on this. The big barrier I have found for a lot of food prep is how much chopping there is involved in the vegetables. And the vegetables are going to be one of the big things that you focus on. When you're deciding what to get at the grocery store, the rule is to try to look for 20 to 30 different fruits and vegetables that you're having access to during the week. I know that sounds like a lot. You can buy smaller amounts of each thing. It doesn't have to be every day. You don't have to, get the fancy fruit that's over in the certain section that's really expensive, but try to be getting different varieties of things. Variety is what feeds your microbiome. The more variety you have, the happier your gut is, the happier your bacteria are, the happier your brain is. I promise you will see that reflected in your neurology fairly quickly if you just change the variety. I know some people tend to kind of prep the same thing over and over, like, chicken and broccoli is your go-to, but the sauce is what changes. Try to vary what you're eating and how you're eating it. Again, I think stir fries are really good for this. My mom called that a kitchen sink dinner. So she would just take whatever veggie, protein, rice was left, put it together. But it was a great way to get variety into kids in particular. That's how we were using it in our family. Again, the other thing to focus on is eating color, as much color as you can. The reason is the color and the diversity, those are going to be full of phytonutrients. Phytonutrients and fiber are going to be the biggest part of making sure that your microbiome and the gut are happy. And again, you will notice a difference very, very quickly. Those two things also help build up the lining of the gut. So if you are somebody who's experiencing food allergies or problems with leaky gut, something like that, adding those in will help rebuild the lining of your gut through the health of your bacteria. And all of this to say that we want to keep the nervous system and the gut moving as well as effectively as possible. Some people will notice a slowdown or a speed up when they change their diet. Ease into it. You don't have to change everything all at once, but when you start making these changes, again, one of the things we want to focus on is making sure the brain's telling the body to work appropriately. So if you know someone who's sluggish there, maybe they don't respond to change super quickly or super efficiently, they can come in and get their nervous system assessed. If you're in the Austin, Texas area, call 512-345-9355. Say the word phytonutrient. We can get that person in to get assessed, any neurological, x-ray, orthopedic testing, a review with the doctor. Again, normally $348. If they say phytonutrient, it'll be $97, and it'll include a pillow to support their neck. We find that that's an area that a lot of people struggle with. So I will leave you with my grocery store tip, which is to shop the perimeter. The middle of the store is where the ultra processed things are. I would also encourage you to read labels. There's a lot of sneaky words, long words that get put in there. The shorter that ingredient list, the better, and make sure that you're just trying to get things that you cook and you prepare as much as possible. Again, it's not just tail on the screen there. It's not something that you will be amazing at all the time, but about 80% of the work is there. And if you can change even a few habits at a time, you're gonna have a big, big difference in your digestive health and your overall health. So thank you for tuning in. We appreciate it when you do. And I am Dr. Mary with 4 Points Family Chiropractic, and to better health.